Hi everyone who is dialed in. Really looking forward to the webinar today. We're going to give people a couple of minutes. We've got lots of people registered, so sit tight for a minute or two and then we'll kick off with some introductions shortly. Hi to everyone who's just dialed in. We're just waiting for a couple more to get onto the Zoom, and then we'll be kicking off with some introductions. As you can see, we've been joined by a fantastic panel today, so I'll be introducing those soon. And for some of the beady-eyed of you, you might see Jamie's joining us from a real-life studio, which is very exciting. Okay, I think we will kick off. I'm always nervous not to start too soon so that people don't miss the introductions, but they can miss mine, so that's fine. So to everyone who's already joined us, thank you so much for attending this webinar. We've been doing a huge amount of work behind the scenes to figure out what are some of the hot topics for 2023 and what is going to be important for you as HR, as wellbeing, as people leaders, passionate about this topic, but also responsible for driving an impact. We've done a huge amount of research and we're really excited to share with you what those top trends are. And I'm very privileged to be joined by an esteemed panel today of different individuals from across our client base who are each here to be sharing their individual perspective on some of these trends. In terms of my introduction, for those of you who I've not had the pleasure of meeting yet, my name is Daisy Abbott and I head up client solutions here at Unmind. I have been with Unmind for almost 4 years and my role here is making sure that our products and proposition roadmap meets the different challenges that our clients and future clients are having. Those challenges are changing all of the time, and we'll be talking through what some of those key topics are in today's webinar. So really, I'm here just as the host to facilitate this fantastic conversation, and I'm really excited that we have so many of you dialed in, but also our fantastic panelists. So without further ado, I would love to introduce them. So let's start with you, Yolandi, joining us from Arup today. Would love for you to tell the audience a little bit about your role.
Fantastic. Thank you so much, Daisy. And thank you again for having me here again. It's great to be here again with you this year again. So I'm the wellbeing lead for UK EMEA. So we've got just under 7,000 staff in that region. And essentially, I look after everything with regards to employee wellbeing. We also look at benefits. We are been doing a lot of work in psychosocial space as well, mental health space. So I have a background in organizational psychology. I'm trained as a career counsellor and a coach, and I spent many years working in wellbeing, perhaps even before it was a thing. So I'm really happy to be here. So thank you again for having me today.
Brilliant. Thanks, Yolandi. And we are thrilled that you could join us again this year. Emily, handing over to you from Grimshaw, would love for you to tell the audience a little bit about your role.
Absolutely. And welcome, everybody. Lovely to be here. And thanks ever so much for the invitation. It's such an important conversation that we're having. So yes, I'm Emily. I've been working with Grimshaw Architects for just over 15 years now. I actually wear quite a few hats around the studio, but I think the one I'm most proud of is the work that I do with wellbeing, something that we've really kick-started since about 2018. So really exciting, heading up all the initiatives. I'm a mental health first aider. I don't have a huge amount of qualifications to bring to the table, but I've had my own experiences, first-hand experiences with mental health. So I can take it kind of from that avenue. And we've also had a wonderful relationship with Unmind. We've been working with our accounts manager, Robin, for nearly 2 years now, and it's a really exciting relationship. So really excited to be here today.
Brilliant. Thank you, Emily, and welcome. We hope we'll be doing many more webinars with you in the Grimshaw team. Over to you, Jamie, in the studio. Love for you to introduce yourself to the audience.
Yeah, good morning all. I'm Jamie Blower. I'm currently at Siemens. So Siemens is a large manufacturing company. I'm working as the health and wellbeing manager, but my background is as a physiologist. I'm very, very new to Siemens. I've been here probably 4 or 5 weeks or so, but generally just delivering the wellbeing strategy for them. I think there's some 4,000 employees here at Siemens.
Brilliant. Thank you, Jamie. And last but by no means least, Rachel joining us from Friends of the Elderly. Rachel, would love for you to introduce yourself as well.
Okay, thank you. Yeah, so my name is Rachel North. I am one of our learning and development leads at Friends of the Elderly. We are a charity of about 500 employees, and we've got care services across the country. So our colleagues are all quite spread apart, and we've been working on developing our employee wellbeing initiatives and benefits over the last couple of years now, which has led to our lovely partnership with Unmind. And I'm really looking forward to the discussion today, and I'm keen to learn some guidance on what all the other panelists are saying as well. So thanks so much for having me.
Brilliant. Thank you everyone for those introductions. So as you can tell, we've got a real mixture of roles, of experience and types of organizations here, from large global businesses to small local charities. So we are hoping that there's going to be lots of different perspectives for you to learn from today. In terms of some housekeeping, we are acutely aware that people are moving from meeting to Zoom meeting to Zoom meeting. So I am pledging to you that we will try and finish just before the hour to give you a little bit of a break, because we have to practice what we preach. So we're looking to run up to about 55 minutes past the hour. Towards the end of today's session, we would love to spend some time on some Q&A. So for anyone who is using the chat, please use the Q&A function. If you've got any questions for our fantastic panel on some of these trends, then we can absolutely touch on those at the end. Now, for those of you who haven't yet read our trends report, I'm thrilled to share with you what those 9 trends are. We are going to be taking a couple of these today and putting these trends to our panelists and asking, why are these so important for leaders who are involved in people, in well-being, and what can you be doing in your organization? So we're going to be talking about why ESG has become such an important buzzword and why it's important to investors and in the boardroom. We will be spending some time thinking about psychosocial risk management and why has this been seen as a new regulation across the world. Another trend we saw was around turning up the scrutiny on wellbeing solutions. Realistically, what this means is that organizations today have been thinking about, what does it mean to be an impactful solution? And what are some of the key metrics that we should be thinking about when understanding if they've been successful or not? Now, we couldn't not speak about the recent financial and economic stress that has been facing employees across the world. And so, as you can read about in our report, employers have been talking about this subject far more. And we've seen a really interesting shift in the stigma in the same way that we have done with mental health and well-being. Now, a big topic, and we will be covering this today, is around manager and leader training and why this is becoming central to workplace well-being. Number 6, a big trend that we found is, how do you connect your HR strategy to your business strategy, and why it's so crucial for people leaders in this space to make sure that everything that they're doing is highly connected to the business strategy. For us here at Unmind, that's where we've seen the most successful initiatives, is what we're doing in the people space is linked to those wider organizational goals. Number 7, we will be talking about champions, possibly one of my favorite parts of the conversation. How can we get champions to have that formal recognition that they are not there to be providing therapy services to employees, but actually what's the boundary of their role and how do we get them to signpost? Data and measurement we will be talking about on today's call, and why that's an essential ingredient to the strategy. And then last but not least, the trend here that the workplace is becoming an engine for positive mental health at work. And we're so excited that we're able to remove the stigma around this topic and actually engage all the way from the CEO down, that this can be something which is useful for employees and something which makes the workplace actually a positive impact on our mental health and well-being. So without further ado, we have taken a couple of these trends and we're going to be digging into them with our panelists. And the first one that we wanted to talk about is trend number 1. So mental health jumps up the ESG boardroom agenda. There's lots of people on today's call, and we're so thrilled that you've all been able to join us. I'm sure everyone on this call will have seen the words or the abbreviation ESG. Some of you might be thinking, what's that got to do with mental health? Or maybe you've heard about environmental measures, but it's that S measure that we're really interested in. And how does mental health play a role in that? Certainly, it's important to executives, to the boardroom, but also to investors. So I'd love to come to you, Yolandi, and get your take on what does ESG mean to you? What does that mean to Arup? And how do you think mental health fits into that?
Yeah, thanks, Daisy. So for us at Arup, ESG is fundamental, and it's one of our core driving principles. So if you look at our strapline is about we shape a better world, and obviously we're out in the built environment, and that's really, really crucial to us. We have committed, Arup has committed to being carbon zero by 2030. And we had also in 2018 set that we would reduce our carbon emissions by 30% this year. So this is the 2023, and that's really saving us, 40 tons of CO2. So in terms of our business, in terms of how we market ourselves and how we position ourselves, ESG is absolutely critical and central to everything that we do. But I think for me, and the challenge has been, since I've been at Arup, is I've been trying to weave the well-being narrative into sustainability, because actually all the research that I read seems to be pointing to the fact that the employee experience has now transitioned and it's shifted, and really the focus for 2023 and beyond is around people sustainability, and that speaks to ESG. So everything that we do, we talk about in the realms of mental health, all our training, all of our resources and support that we do, it comes back and it's anchored back to the wider narrative that we're running in terms of our ESG, in terms of our purpose. So we have a very, very clear purpose statement. So everything we do is anchored back to the purpose, such that people are seeing the value of their job, but also the value of us maintaining and exercising our duty of care to our colleagues and keeping people safe. So this is, of course, not just linked to ESG as I see it. This is linked to the psychosocial risks, but this is also linked to, how well-being in particular has helped actually propel the sort of people agenda up the boardroom and into the C-suite, because actually through data, and we've got some really, really impactful and profound data, by being able to tell those stories, suddenly people want to listen. And actually if we can weave the narrative in the same language as our commercial narrative, it's really, really very impactful for our business.
And do you see a world, Yolandi, where, you talked about Arup itself having very externally facing goals around the environmental data. Do you see there being similar from a social perspective and for mental health? And maybe are you already on that journey? Because I think it's interesting that I think the mental health and the social metrics are a little bit further behind from the environmental. I wondered if you had any views on how mental health will become an externally facing measure that companies will be asked to report on.
Yeah, I think we are definitely further behind than I would like to be. Look, we've made massive progress in the last year, 18 months. And so what we have done at a global level, obviously Arup is global, is we have committed to wellbeing commitments, and it's 3 commitments which we've committed to, and we're delivering on that. And within that, there are certain KPIs, some of which are related to mental health. In our region, in the region that I look after in UK EMEA, we have established a group of mental health first aiders or mental health safety ambassadors, because they operate across the entire geography. And we have some very important KPIs from this group, which we're taking back to management on a regular basis. Yes, we are behind where we need to be, but for me, the key thing and the key challenge has been that data, and having data from multiple sources so that I can actually then demonstrate the impact and the value, because it's about that ROI all the time. Otherwise, it kind of loses its importance, really.
Thanks, Yolandi. I'll just pause to check if any of the other panelists have any comments on ESG before we move on. Okay. So ESG, from what you've shared, Yolandi, is certainly something which is growing in importance, but it does feel like we are some way off what are going to be those key measures externally. I wondered if anyone who's dialed in today who has any stories of successfully implementing really important S metrics and mental health metrics, please do put them in the chat and share with others. We definitely want to be sharing best practice as much as possible on this call. The next theme that I wanted to spend some time on is theme number 5 here. So manager training and leadership development becoming central to workplace wellbeing. Now, to share our view and what we have experienced through the eyes of our 200 clients globally, we've seen an incredible number of customers come to us talking about the fact that managers have been struggling with this topic. And I think, broadly speaking, we would split managers into 3 groups. So you have your managers and leaders that maybe have experienced mental health themselves or a family member, and they feel somewhat equipped to have this conversation through their own life experience. Then you have managers who are very nervous about exacerbating someone's symptoms, so don't have the conversation. Then you have the managers who feel it's really not part of their role and it isn't in their remit. So with those 3 groups, we see huge opportunities for them to be a supportive role that signposts. I'd love to come to my panelists now to hear their view on why they think this is such an important topic and what they've been doing in this space. Rachel, perhaps I'll start with you, knowing that learning and development is something that you're owning within your organization. What do your managers have in terms of resources for this, and what kind of focus have you put on this at your organization?
Yeah, absolutely. So I think the key thing when talking about manager training and leadership development in the wellbeing space is the focus should be predominantly on managers' mental health first. So, do they know how to cope with their own mental health and wellbeing? And if we're constantly bombarding them with training requirements for them to support others and neglect them as employees themselves, then no change is ever really going to be substantial. So that's where we've started at Friends of the Elderly, is focusing on making sure that our leaders, our managers have the skills to support themselves before supporting others. My practical guidance there is to give leaders the time to focus on developing their skills to cope with the situations, hopefully opening up their diaries for further learning and support of others. I think the biggest issue we've had, probably similar to most organisations, is the issue of time when it comes to leadership and management. So as the learning and development lead, my focus has been on creating sort of bite-sized content, smaller chunks of learning, but also weaving in self-reflective exercises as much as possible. So even if it's just emailing a question out at the start of each week to all leaders, asking them about a leadership style, getting their thoughts on it, but then having, as an L&D team, a library of resources available for them to focus on once they've identified that skills gap. It doesn't have to be expensive. I think that's what, as a smaller organisation, we really try to focus on. So, we will have teams, we will have cameras on our phones, sending out a video at the start of each week to managers, asking them to reflect on a particular leadership skill. It doesn't cost anything. And as I said, we're really prioritising those reflective exercises. So getting our managers to actively think about where the gaps might be in their leadership styles. They're so much more likely to appreciate the content that they're then consuming following that. And then I think when it comes to budget, it's about balance. So if you're going to spend money on training, one of your other trends in this report was talking about asking providers more searching questions. So making sure that it's relevant, really thinking about it before sort of going for the next best thing, but then really utilising your existing content. And your colleagues. Most organisations will have that one person who's really doing it right. You know, you look at them and you think they've got this, they're a great leader, and people seem to feel comfortable talking to them. So reaching out to them and utilising them within your organisation. They could perhaps run a workshop for you, or they might feel happy to record a video to send out to managers. So yeah, that idea that training materials don't always have to be really flashy and expensive. It's about utilising what you've got already.
So many practical examples in there. Thank you, Rachel. I know this is a really hot topic and everyone will have some thoughts on this. Emily, what's your view on why do you think this has come up as such a big trend for this year, and what's Grimshaw's take on that?
Yeah, well, I agree with a lot of what Rachel referred to, actually. We also need to be mindful of our managers' well-being. You can't fill a cup from an empty jug, essentially. So actually kind of tackling that initially, those conversations. We have an appraisal system and a development review system. So we encourage our leaders and our line managers to sit and have conversations with our staff at least twice a year. And in those conversations, we encourage them to ask the questions, how are you? So we really need them to be equipped with how to deal with those responses. So again, as Rachel said, it's not for us, it's not a money subject, if you like. I think things can be done internally. We have a group of 6 qualified mental health first aiders, which are all very kind of open to giving out some training into how to deal with sometimes some really difficult and challenging conversations. It's more of the time for us. We meet some really challenging deadlines within the architectural industry, as I'm sure many other industries do. So again, as Rachel said, bite-sized chunks, addressing them in smaller sections rather than taking our managers and leaders out of work for a day or 2-day courses. That's unmanageable for them. They're not invested, if you like. They're constantly checking phones, understandably. What Zooms are they missing in and out of the room? So I think capturing them in smaller bite-sized chunks is really the way forward. And also we carry out an annual staff survey as well, which gives us really, really crucial information as to what our leaders want and need. So we kind of use that as a bit of direction. The data from that is incredibly important. What do our staff want from our leaders? What are they currently getting, or what are we missing out on? And then we focus on that for the next 12 months. So that for us is really important, is listening to our staff. What are our leaders providing them, and what could we be doing better?
Thanks, Emily. I think there's some interesting thoughts there on how you go about engaging people who aren't constantly behind their desks or, out on sites, as I imagine lots of your employees are. I wondered also with your demographic, Emily, if you'd seen kind of different types of engagement in training, and has that led to you providing resources in a different way?
Yeah, I mean, absolutely. It's not for everyone, these wellbeing conversations. A lot of our architects are really focused and tend to be on their art in their industry, and not necessarily renowned for being particularly social people's persons. So we need to come in and support that. What's lovely to see, though, is our wellbeing team is built up as 6 at the moment. We're looking to get more, and actually 4 of those people are architects. So it's wonderful to see us kind of spreading the word that actually we can be having these conversations within the architectural industry. It doesn't always have to be about design. The people are equally important. So I think it's about reaching that balance, Daisy, as to, we don't throw it down their throats. Actually, it's important to just find a really healthy balance between those conversations.
Yeah, thanks, Emily. I imagine, Jamie, thinking about Siemens, you too have quite an interesting varied demographic to try and engage, and I'm sure there's a long history of different training methods at Siemens. Given you're new into the role, I'd love to get your take on how you see Siemens are navigating this topic, and maybe any examples from your previous roles as well, as how you've successfully engaged managers on a topic, which I think, being fair, not every manager does want to engage with.
Yeah, definitely. And yeah, managers are really, really important, aren't they? They bridge the gap between, occupational health, EAP, peer supporters, Unmind. They're really, really important, and upskilling them and having those conversations around mental health, how to signpost, how to access support for their own, mental health and well-being is imperative. Yeah, as you said, I'm very, very new to Siemens, so haven't yet done any managers training, but in previous roles, I've led training, which ultimately I think it's important that if you're leading training, that you quantify the benefits of the actual training material. So we did baseline results on things like, do you feel comfortable having a conversation around mental health? Do you know where to signpost, your staff member to if X situation happens? Do you know how to support your own mental health? Launch training, and then, quantify the benefits of it and measure it, pre and post, which I've done previously and looked at the benefits, and, really, really seeing the benefit of employees feeling comfortable to access support from occupational health, third-party supports, which had, when the training was launched, a significant spike in employees accessing support for their mental health, followed by, a peak and then a trough and then a plateau, which hopefully highlighted that, more and more employees that were experiencing a mental health problem then, gained access quite rightly, and then, felt comfortable to maintain access.
And I'm interested in, given, you will have seen lots of different manager programs in your different roles, Jamie, what do you think is a measure of success? How can our audience think about demonstrating the impact? And this links us back to one of the other trends, which was, wellbeing solutions are being scrutinized for their impact. So I'd love, your view, and anyone else from our panel. How can you say this manager program has had a positive impact on the business? And we know this is going to have a positive impact on the teams that sit underneath them.
Yeah, like I said, taking those measurements, baseline and post training on things like, do you feel comfortable having a conversation around mental health? Do you know where, support signposting material is? I think is a good metric to quantify the benefits of launching training and what that actually means to managers. But then, of course, other things like utilization of occupational health, EAP and Unmind, I think are really good metrics that if you are launching managers training, are useful to keep an eye on to see if there is change.
Any of our other panelists been grappling with how you demonstrate the impact of these types of initiatives?
I think for me and Anara, a key one is, in addition to everything that Jamie and everybody else has said, I agree with everything you said, but the other key one is actually that 360 feedback. So there's a piece about the data, the quantitative, but we also need the qualitative. And actually in the context of cultural change, that is really, really important. And that feedback builds then into the kind of trust which we're looking to build. So for me, that feedback and making that more commonplace is really, really important. And I think it sort of then becomes a virtuous circle in terms of demonstrating the effectiveness, impact, and I suppose you could say efficacy of the training by actually having that feedback, and it kind of becomes that virtuous circle. So that's really, really important for me. And then I think also another really, really important thing is actually the training, and this is around quality and scrutinizing who does the training. I actually believe that some of the training, particularly when we're coming to mental health training, and I'm very passionate about mental health training, so forgive me if I'm on my soapbox here, but it kind of needs to be led by an expert, such that we're actually equipping people with the right tools, the practical tools about what to do should somebody disclose. What do? You don't just run away. How do you approach us? What do you do, and how do you stay safe? So it's kind of all linked. Nothing occurs. I don't think anything occurs in a vacuum, and everything should be working towards helping to demonstrate the impact of what we're doing.
Great, thanks, Yolandi. So lots of really interesting thoughts on manager training and leadership training there, which I'm sure is giving some practical ideas to our audience. The way that we view an organization here at Unmind, when we take a whole organization approach, means that the executive teams at the top, we believe, need to be engaged. managers need to be engaged, but then sitting underneath that is this layer of champions. Now, they tend to have different terminology in different businesses, ambassadors we've heard, allies we've heard. We're really interested on the growing interest in how they can not simply be a resource group, but part of a strategic initiative. And I'd love to have a bit of a conversation about champions, people's experience with them to date, and how they've been used effectively. The last piece around effectiveness is something we talk about a lot of the time, because we've heard many stories of organizations launching champions networks and not being able to demonstrate the impact that they're having. A customer we were with yesterday mentioned this concept of feeling like it's that whack-a-mole game, that you have champions coming up all over and they're maybe having conversations which are outside of their own skills, expertise, and remit. So how do we position a engaged group of individuals who are passionate about the topic, but really make sure that there is clear lines and boundaries over their role? So lots to say on this topic, but Emily, I know this is something that you've been grappling with and have experience with it at Grimshaw and potentially in other organizations. Yeah. What's your view on the role of champions, and what would be your advice to the audience on how to make this not just a nice to have, but a strategic initiative?
Definitely, and I think Yolanda referred to feeling valued in part of the first half of this webinar, and it's about making those champions feel valued in the work that they do. Many companies are now kind of advertising for jobs, and like you said, Daisy, it could be under the skies of many different job titles, if you like, but fundamentally doing the same work. I think it's about outlining the boundaries of that individual, and I think we've realised that over the last few years that we've been working towards the well-being of those at Grimshaw, in that we've almost got two teams, if you like. So we have a team of mental health first aiders who have taken the course and are incredibly passionate about what they do, and we've actually created a job description for those individuals, which has been really helpful, just in terms of managing their expectations, but managing our expectations of them as well. I think it can be quite a cloudy role to have when people have a day job, if you like, and this is something that they're also bringing to the table. So we have a very clear outline from the get-go, and we share that with them before they take the course, just to make sure that that is something that they are interested in carrying on, and what the expectations of them after the course. And then we have a wellbeing team, and actually that is just a lovely team to be part of. It's something that actually we bring them in when we have initiatives, when we have our World Wellbeing Week, when we have Mental Health Day. So it's not, in terms of strategy, we have a core team that are very devoted to it. And then we have the wellbeing team, which is a wider group of people that are brought in. I guess we're all champions. We're all championing the same thing. So it's about feeling valued. And I think we have a wonderful partnership at Grimshaw who recognise that. We have a time to talk session once a month, and actually our managing partner turned up to that last week. So I think it's about listening to the wellbeing champions, making sure that they have a platform where they're heard, but also carving out clear expectations and boundaries for those people. It can just be quite challenging if it's not their full-time role, which we found out.
Definitely. I'm sure Rachel, Yolandi, Jamie, you will have seen champions in your roles as well. Have you any sort of advice or guidance for our audience on what makes that group a group of individuals that have clear boundaries but can still be quite effective?
I'll go if that's right. Yeah, I think really importantly, leading training, whether or not it is internal or external training, to make sure that they feel engaged, but also that they have the autonomy to go to their local area and lead, central wellbeing campaigns that you're doing for the whole company, but then also bespoke wellbeing initiatives for their people. They're the representative for their local area delivering wellbeing initiatives. So I think it's really important that they have that downtime where they can reflect together as a team, upskill, and yeah, lead the most appropriate health initiatives for their staff.
Any other thoughts on champions before we move on?
I just asking a question myself, but we're in the process of trying to introduce the Wellbeing Champion programme, so we're really at the early stages of it, and I wonder if any of my fellow panelists would be able to tell me the first thing we should do in starting that Wellbeing Champion journey. We want to end up to have a Wellbeing Council, and like you said, Emily, very similar to the success of how you've done it at your organisation. But if there was one thing to start off with, what advice would you give me? Sorry, I've hijacked the question.
I know Unmind have Wellbeing Champions training coming, but my one bit of advice would be make sure they're aware of the responsibilities. It's a bolt on for their role. If they don't have capacity to volunteer and do the wellbeing initiatives, you quite end up just with a big group of people that want to lead wellbeing initiatives but don't have the time to. So yeah, make sure they're aware of the responsibilities and what that involves and the time required to be part of it, whether or not their line manager needs to be involved, senior leaders need to be involved of what that entails.
Yeah, I would definitely echo the I think the roles and responsibilities piece is critical to outline very clearly. I'm thinking of resources that we've provided our clients before, and it very clearly says a champion is XYZ, a champion is not. And I think reminding people that there's a time investment in being a champion. If you think of a couple of years ago, pre-pandemic, when we were all in our offices or on site, and we would wear the lanyards that said we were a champion, it was quite a visible role that people had. But I think factoring in this hybrid nature, what does work look like today? And therefore, how do I access a champion? And when I do, exactly what their role is will mean that that's definitely a connected and effective initiative. But yes, you're right, Jamie. We've just been filming our recent champions training and taking on board everything that we've learned about champions resources in the past, and how do you ignite a really excited and engaged workforce, but be very clear with what their roles and boundaries are. So definitely lots of support that we can offer you there. We had a question from the audience for all of you on the panel that have had champions groups. Do you collect any anonymous data from your champions? And maybe if you do, what are some of those use cases?
So yeah, we collect anonymous data in the form of, we do a survey, and in that survey we check how effective the champions are they able to operate effectively, and then we also check all sorts of other things, as you would imagine, on a wellbeing. It's a bespoke wellbeing survey, so we also check the mental health safety ambassadors, and effectively we're checking how comfortable and competent do they feel in their role, because before they start their role we provide them with training. They all have a role profile, so it's very, very clear, and then essentially we're checking that. We also check with the business the effectiveness of those champions as well, so we're getting a number of different feedback sources and metrics.
Great, thank you, Landy. Speaking of surveying and data, it makes sense for us to think about that trend that we saw come up. And I'll put it back on the screen so that we can all see the wording. So number 8, data and measurement becoming an essential ingredient to workplace wellbeing strategies. Now, I think it's fair to say that whilst we have this as a trend for 2023, this has been growing for many years on the topic of mental health and wellbeing. And with my background as a practitioner in the NHS, the way that we would measure mental health and wellbeing was often with global standards like the PHQ-9 and GAD-7 that measure someone's rate of anxiety or depression. And we use those in the NHS to ultimately decide what level of support someone needs. Now, when you take that to the workplace, those measures use the kind of language you would experience if you were really in a crisis. So we've been thinking about what's the right language to use in an employer environment, and how do we effectively give an employee the tools to understand how their mental health and wellbeing fluctuates. Now, zoom forward a couple of years, we're not just thinking about individual measures, we're thinking about organizational measures as well. So what are the social determinants of mental health and wellbeing that makes an organization more mentally healthy? What does psychological safety look like? What is the level of leadership support I need so that my organization is ultimately performing better? So we've seen some really interesting trends in moving away from simply individual measurement to organizational measurement. Unmind have launched our own measure here, the Workplace Index, which looks at 8 factors that make a more mentally healthy workplace. But also key, we'll be measuring things like presenteeism, absenteeism, and attrition. As we know, these are the big costs that executive teams want to hear about. So we know that this is a big topic for our audience and certainly for our panelists too. Jamie, I know data's very close to your heart. I would love to get your thoughts on, you know, in your years in wellbeing roles, what has been the kind of data that you have seen effective to make your role much easier? And maybe what does that look like for 2023 in your role at Siemens?
Yeah, definitely. So for me, data's number one on the top of the wellbeing strategy. You know, leading wellbeing initiatives should be data-led, evidence-based to make sure that they're most appropriate for staff. So as I said, I'm very, very new to Siemens, and step one was to review all the relevant data. So things like sickness absence. So looking at Siemens sickness absence, I think it's clear that it's probably in line with the majority of UK workforce. You know, mental ill health, anxiety, depression, burnout, MSK, you know, back pain, neck pain, and then probably comorbidities to obesity, things like hypertension, type 2 diabetes, cardiovascular disease. Having that data obviously allows me then to, you know, look at bespoke parts of it, you know, the split between, you know, sex, age, ethnicity, location, and what that means to staff, and then leading wellbeing initiatives from that, and then reflecting back on that data to see if there's any change. I know you briefly mentioned around, you know, other metrics, and in a previous role, I did find it really, really useful doing things like the ONS4, Fatigue Assessment Index, Perceived Stress Scale, WHO5, doing, you know, on-site pilots, taking those metrics, implementing an initiative like, you know, health checks, training, whatever it is, and then reviewing the change to quantify the benefit of implementing the wellbeing initiative.
And the data that you would get from those surveys, Jamie, I'm sure was critical to the wellbeing team, the people team. Have you found that data useful to educate your executive teams or the CEO on what the state of mental health is?
Yeah, I guess I'm sure the majority of boardroom talks revolves around ROI, you know, the cost of implementing initiatives and also the cost of sickness absence, and having that data of total sickness absence with the breakdown of which diagnosis group each is and the cost per, you know, sickness is really, really important, and then leads on to, you know, the importance of leading certain health initiatives to directly, you know, facilitate change in those areas.
I'm interested for others on the panel, you know, what kind of data their executive teams are asking for, other than some of the things that Jamie mentioned. Yolandi, I'm sure, you know, ARIPS is also another very data embedded organization. Is there data that your executive teams are asking you for to demonstrate what's going on in the business and also how impactful things are?
I think definitely. So you know, often people band about a comment and throw about a comment, and the challenge is always, well, actually, what's the data telling us? So going back to Jamie's point of kind of being evidence-led and the data. So data is king and data is key here. But in addition to those sort of third-party metrics, so your EAP, your sickness, your occupational health, in addition to all of those metrics, for me, the internal metrics as well are really, really important. So what about your turnover? What about your attrition? You know, your rate of sickness, you know, and then also your utilization. So we've got a team who are looking at fatigue management as well, you know, so hours work, fatigue management, and then sort of triangulating all of that with the external data, and then your exit interviews, and then your survey data. So your pulse survey and your wellbeing survey data. What is all of that telling you? And hey, presto, there are certain pockets pockets, and there are certain regions and certain offices where they flash up bright red, and that kind of highlights that ergo we need to do something there pretty quickly. But what we are finding as well, and I think Arup is no different to any other industry, we are finding that year on year the reporting of mental health is going up. So while we are doing much more awareness raising, much more equipping and training, in terms of our external statistics from the EAP and occupational health referrals, mental health claims are going up all the time. So it really is central that the business understands it and grapples with it so that we can actually deal with it, because it's there in evidence in black and white. You can't dismiss it.
Just to that, and something that we're kind of just at the very beginning of, and something we've spoken with Robin and the team about in terms of the workplace index, because I think it's really important that that's on our plan for Grimshaw for the next 12 months. But in terms of mental health being reported going up, is that not also an indication that we're becoming more open to talking about it? And so how do you measure that? So we started our conversations back in 2018, and so we may have found those stats quite low then, but the fact that we're being much more open to these conversations, could that be clouded in terms of the stats that are coming out because we are talking about it more?
I think in part, and I just think so there's a societal thing where generally as a society much more open about it now. So we get stats for different countries, and we definitely do see that in the UK, and in particularly within the UK, in England, our stats and our reporting for mental health is much higher than it is, say, for example, in Scotland. Our stats for India and South Africa and Mauritius, they don't report it because it's not spoken about, even though they're still receiving the same training. So there is something about contextual sensitivity and specifics. But I do think that actually it's only now that we're being able to properly quantify the real cost, the real pounds and pence cost of actually not getting mental health right. And this is not just 1 year, 2 year. This is like it's been ignored for the last 20-25 years, and now suddenly we're trying to play catch up to get where we need to be.
I think it's a great question, Emily, and something that we've been talking to lots of our clients about, which is there a catch-22 of us discussing this subject more? And Unmind's been around for well over 5 years now, but certainly in our earlier conversations, we did face some pushback from companies saying, we're not sure we really want to bring in the conversation of mental health and wellbeing because we're worried that might make people realize they have something that they didn't know before. And there was a real fear that talking about it would lead to higher incidences. Our view, as you can imagine, was that the incidences are already there, and there's a duty of care for a company to really provide those resources because it's good for the employee and it's good for business. There's so much data linking happier, healthier employees are much more productive, take less sick days, and take quicker to recover. But yes, I do think the more we've talked about it and the more it's a discussion point will lead to more openness to disclose. And when people are filling in with their HR system that they're taking time off work, what used to always click the first one, which is cold in brackets flu, people are now thinking I might actually disclose that I am struggling with my anxiety, depression, or other low-level mental health conditions. And we see that as a real positive because the more stats we have, the better support we can give. But fundamentally, I think we also have to acknowledge that the rate of mental health illness has gone up, and statistics about the impact of the pandemic showing a 29% increase in burnout from 2021 to 2022. And if we think about generationally as well, really interesting data from Deloitte showed that younger people amongst the kind of working populations were more highly impacted in light of the pandemic. And so if we think about those really growing in their career and actually the proportion of our working population that they are starting to take up, we're bringing into the workplace people who've already gone through a hugely traumatic experience and were impacted in a much higher way. So I think the data we've got today is showing that more people are talking about it, but that the problem is certainly bigger. Jamie, I wondered if this has been something you've looked at in previous roles as well. You know, how is that data showing a rise in incidences as well as a rise in the conversation?
Yeah, I think I mentioned it earlier, didn't I, about when we launched the mental health awareness training previously, which was within the railway. So there's about 600 odd managers, people managers, that the training was launched. And yeah, as I said, as you start to train, you destigmatize mental ill health and then see a sharp rise, you know, in employees reaching out for support, followed by, or, you know, in that situation, the training, followed by, you know, a peak, a trough and a plateau, which hopefully highlighting that employees felt comfortable accessing that support sort of for the long term.
That's great. Thank you. So we've got a couple of minutes for some questions, and we've been receiving some really interesting ones. So thank you to the audience. I'm just reading through some of these. The first one is, and I'll direct this to anyone on the panel who has a view on this, but how do you get to those employees who are under the radar, the people that you don't often hear about, that's causing this audience member some worry? So how do you engage those people that maybe aren't that engaged?
So I think, well, certainly for me, you have to sometimes accept that you're never going to get everybody on the dance floor, and that's not a sort of glass half full perspective. It's just the reality. But the real key thing in terms of engagement is making sure that there is a central place on your intranet where all the comms and all the information is very, very clearly laid out. But also part of that engagement piece is about making sure that they have a number of different people they can go to for help. So it's not just their line manager. They have a wider safety network and a web of support that's not just one people. And I think that needs to be built up in an organization. And once with that, together with very clear comms where people can find information, nothing's hidden, it's very visible. I think together with that, it sort of helps. But the reality is that there will always be some people that we don't get to, sadly.
I'll echo that. Yeah, just to add as well, you know, yeah, like you said, you're never going to engage everyone within the wellbeing strategy or wellbeing initiatives, but important leading comms that is a diverse set of comms. Is it, you know, the Yammer, the internal, you know, SharePoint, whatever site it is, and then is it, you know, payslips, phone blasts, booklets at home, whatever it is, to ensure that you're doing an array of comms in your strategy to reach those people that might not necessarily, you know, look at their emails.
I think that's really, really helpful, Yolandi. And I think what's really good about these sessions is having that transparency from experts like yourselves, which is, you know, you won't be able to engage everybody. And I think continuing those efforts for a diverse communication strategy is definitely good advice. Flipping that on its head a little bit, we've had a question coming back to wellbeing champions. One of our audience has written in to say that they're really keen to get a more diverse team, but it's a very female and very HR-driven group. How do you get a diverse team of champions without forcing people?
Interesting. We took a quite a novel turn, and we asked for individuals to share their experiences with mental well-being. And we put a beautiful series of journals together called Mind Blown. And actually we shared them as a document online and physically in the office. And I think it's that realization that not just women and not just people in HR have well-being struggles. And I think that really kick-started our journey with well-being at Grimshaw. Actually, it was a very honest, very open, very emotional set of journeys from people around our global studios. So maybe something initiating the general conversation at first. I think naturally they are we saw something similar, so we thought something had to shift. And so yeah, that was a bit of a novel way of doing it. It doesn't work for everyone, but we found that was really got across a section of our studio on board with our groups.
Great, thanks, Emily. Any other advice for how to get a diverse champions group?
Yeah, I guess I'll add in. Yeah, I've previously led a TRIM team, so trauma risk incident management, which are peer supporters on the railway that supported those employees exposed to a traumatic incident. And it was really, really useful trying to get a diverse set of peer supporters doing applications. So we just did applications, and as Emily said, you know, having those people, you know, champion their stories and their experience was really, really then easy to, you know, have a diverse group of peer supported.
Thanks, Jamie. Some great practical options there. So I promised everyone that we would finish with just 5 minutes to spare. So I wanted to make sure that we give you that time. To anyone who hasn't downloaded the report, there's a QR code on your screens, which you should be able to see. And then you can read all about the 9 trends, which have come out of our research. Thank you to everyone for your questions, but of course, our huge thanks to our panel, to Emily, to Jamie, Rachel and Yolandi. Thank you very much for joining us. And I hope everyone takes the next 5 minutes before their next meeting for a quick break and some refreshments. For any other questions about us here in the team at Unmind, please don't hesitate to get in touch. Thank you so much for joining.
Thank you.